Malaria. Malaria is a serious and sometimes fatal disease caused by the protozoan parasite Plasmodium. It commonly infects Anopheles mosquitoes, which feeds on humans. The Plasmodium is a genus of unicellular eukaryotes. The Plasmodium species have a very unusual gram strain and have been shown to elicit positive or negative strain depending on the overall form. Malaria is an ancient disease in reference to what was almost certainly malaria occurred in a Chinese archive from around 2700 BC. Earth tablets from Mesopotamia from 2000 BC, Egyptian papyri from 1570 BC, and Hindu writings as far back as the 6th century BC. Comprehension of malaria parasites starts in 1880 with the revelation of the parasites in the blood of malaria patient by Alphonse Lebrun, image on the right. On the image on the left, Sir Ronald Ross discovered the malaria parasite and went on to prove the role of Anopheles mosquitoes in transmission of malaria parasite in humans. Epidemiology. Most malaria cases and deaths occur in sub-Saharan Africa. In 2018, there were expected 228 million cases of malaria around the world. An expected 90% of deaths in 2016 were in the WHO African region. Pathology. Malaria parasites enter a person's circulation system and travel to the liver. At the point when the parasites develop, they leave the liver and contaminate red blood cells. Individuals with malaria frequently experience fever, chills, and flu-like illness. Left untreated, it may develop severe complications that will result in death. Indication of malaria can develop as fast as 7 days after getting bitten by an infected mosquito. Incubation period is 7 to 18 days. Response and treatment. Plasmodium. The parasite responsible for malaria impairs the ability of key cells of the immune system to trigger an efficient immune response. Malaria is treated with prescription drugs to kill the parasite. The types of drugs and the length of treatment will vary. The most common anti-malarial drugs include artemisinin-based combination therapies. ACTs are the first-line treatment for malaria. There are few unique sorts of ACTs. Examples incorporate artemether lumefantrine cordyum, artesunate amodiaquine. Each ACT is a mix of at least 2 medications that neutralize the malaria parasite in various manners. Chloroquine phosphate. Chloroquine is a preferred treatment for any parasite that is delicate to the medication. In any case, in numerous parts of the world, the parasites that cause malaria are impervious to chloroquine, and the medication is not at the point an effective treatment. Sociopolitical Economic. The CDC was founded during World War II as the Office of Malaria Control in War Areas. The role of CDC became one of surveillance inside the U.S., also of help with overall endeavors to kill or control malaria in financially underdeveloped regions of the world. Extending your thinking. From what I've gathered in my research, malaria has a potential to be eradicated as early as 2050. 41 leading experts advocate for a number of actions, including increased funding, creating a single global hub to track and respond to pockets of transmission, and a global training program to produce a network of malaria eradication professionals. It is reported that with the right strategy and action, malaria could be eliminated within a generation. 2 questions I generated about this research is: How much will the vaccine cost? Will lower income countries suffer the cost of the vaccine?